What is polyp? Polyp is hypertrophied, edematous, non-neoplastic and prolapsed mass or mucosa of nasal and paranasal sinus. Let's talk about antroconal polyp, mainly seen in children and young adults, mainly single and unilateral, originated from mucosa of maxillary sinus and exists from sinus ostium or accessory ostium, mainly due to infective sinusitis or due to anomaly in sinus ostium. So there are basically four parts of antroconal polyp. First one is conal part, then neck and the antral part. Conal part and antral part are globular structure, whereas the nasal part is flat structure. So symptoms of antroconal polyps are nasal obstruction, that is initially unilateral and may become bilateral if it obstructs nasopharynx. So initially it originates from maxillary ostium of maxillary mucosa of maxillary sinus, and they grow toward posteriorly, and if it obstructs or affects the nasopharynx, that the obstruction become bilateral. And the other symptoms are change in voice, that is voice becomes dull and thick, and other is nasal discharge, that is mucoid type, it is due to infection. And other signs are in enterorhinoscopy they may be missed because they grow posteriorly due to the ostium directed posteriorly, and the direction of air flows, that is from anterior to posterior direction, and there is large space posteriorly, and there is slope posteriorly, and there is beating of cilia in posterior direction. In posterior rhinoscopy, there is a globular mass filling choana, and the nasopharynx is seen, and in probe test they are mobile, no pain there is, the non-pain sensitive, and there is no bleeding. So you have to differentiate between the antroconal polyp and hypertrophied turbinate. So in case of antroconal polyp, they are not non-pain sensitive, but hypertrophied turbinate are pain sensitive, while antroconal polyp are mobile and hypertrophied turbinate are not mobile, and they are smooth and they are hard. So investigation are one is X-ray, that is water view, and also called as occipitomental view. And in this X-ray we can see opacity of maxillary sinus. In X-ray of lateral view, crescent shadow sign is seen, and we can also do endoscope, that is diagnostic nasal endoscopy, and CT scan of PNS, paranasal sinuses in coronal cords. And treatment of the antroconal polyp is mainly preoperative and postoperative antibiotic to avoid the infection, because this polyp is mainly due to the infection of maxillary sinus, so we avoid infection. And the main treatment of choice is functional endoscopy sinus surgery, also known as FES. Yes. And in case of reoccurrence, we can do Cadwell lock surgery. So to avoid recurrence, complete removal of polyp is done. Cadwell lock surgery is done in case of reoccurrence, and wide middle meatal enterostomy and antibiotic in postoperatively given. These two are because to avoid infection of maxillary sinus. So thank you so much.